So good afternoon, everyone, and welcome to our fourth in this series of webinars from the Dalai Lama School of Public Health. Today, we're delighted to be sponsored by the Center for Global Health, and our topic today is equity, rights, and global health during COVID-19. I'll very shortly introduce the panelists. But first, I'd like to start with the land acknowledgement. We would like to acknowledge the traditional territories of the Mississauga of the New Credit First Nation, Anishinaabe, Wendat, Huron, and Haudenosaunee indigenous peoples on which the Dalai Lama School of Public Health now stands. The territory was the subject of the Dish with One Spoon Wampum Belt Covenant, an agreement between the Iroquois Confederacy and the Confederacy of the Ojibwe and allied nations to peaceably share and care for the resources around the Great Lakes. We would also like to pay our respects to all our ancestors and to our present elders. I would also like to thank Erica Di Ruggiero and her staff, Liz Loftus, Ophelia Michaelides, and Vadim Levin for their assistance in bringing this together. So first, a little bit of housekeeping, and then I'll get started. So we're going to try to address as many questions as possible. In the first three webinars, we've mostly focused on local issues. And as this is a global pandemic, we're now turning to the sort of global dimensions of this pandemic. You can direct any questions you have after this webinar to this email address, ghoffice.dlsph@utoronto.ca. And during the webinar, you have two options. You can chat amongst yourselves with the chat function, but there is also a Q&A function for this webinar. And if you have a question that you would like the panelists to address, please direct your question to that function in the Zoom. So without further ado, I'd like to introduce our panelists today. We have four distinguished faculty and a distinguished student, I should correct that. And we're grateful for them taking time out of their busy schedules to be with us this afternoon. We're going to go in order, and the way it's going to be is each of the panelists is going to speak for about 5 minutes to give their high-level overview and insights. And then I have directed questions for them, and then we'll open up for question and answer. So our panelists today are Professor Paula Breitstein, who is an epidemiologist who's actually joining us from Kenya. She's an associate professor at the Dalai Lama School of Public Health and a visiting professor at Moi University School of Medicine in Kenya. We also have with us this afternoon Lisa Foreman. Dr. Foreman is an associate professor at the Dalai Lama School of Public Health and is a Tier 2 Canada Research Chair in Human Rights and Global Health Equity. So right on point for today. We also have with us Dr. Arjuman Siddiqui, who is the associate professor in the Dalai Lama School of Public Health and the Canada Research Chair in Population Health Equity, and newly appointed division head in the School of Public Health as well. Our student joining us today is Sarah O'Sullivan. Sarah is a PhD candidate in the Department of Anthropology and is part of the collaborative specialization in global health. Finally, but last but not least, is Dr. Erica Di Ruggiero, who is the director of the Center for Global Health and is the sort of overarching host of the event, and the director of the collaborative specialization in global health and an associate professor in the Division of Social and Behavioral Health Sciences at the Dalai Lama School of Public Health. So without further ado, Paula, I invite you to open the proceedings, and thanks for everyone for joining.
Thank you very much, Ross. I want to start by reflecting on where SARS-CoV-2 comes from, the virus that causes the disease we call COVID-19. It's a zoonotic disease, so meaning that it jumped the species barrier from animal to human. In this case, it's thought to have originated with bats, passed through the intermediate host of pangolins, and onwards to humans. The specificity, though, glosses over and understates the complex dynamics underlying this fact. Specifically, it reflects a very close interface between humans and animals, an interface that arises from large-scale deforestation, loss of habitat, hunting, poaching, among other things. The purpose of this is obtaining products to sell on local and international markets, including the black market. In the case of COVID-19, the virus came as a result of the thriving wildlife trade in China. So let's just briefly review the global epidemiology of COVID-19 to help us understand the global context. And as you can see from this slide, which I forgot to share before I Did this? Okay, I hope you can see that. The countries with the most documented cases are generally in high and medium income regions, which I think everybody knows. And you can see here that the darker blue countries are the ones with the most cases reported in the last 7 days. Currently, Africa has the lowest number of cases at just over 16,000. But there's a lot of diversity in both caseload and testing rates. And you can see from this that South Africa, for example, leads the continent with the absolute number of cases and the number of tests. But Algeria leads when you measure it by cases per million population. The situation is changing rapidly on the ground, and pandemic is growing in Africa. And in general, it looks like we're a long way from flattening the curve here. So, trying to stop sharing my screen, but it's okay. So why are some higher income countries so hard hit compared to lower income ones, at least for now? Well, among other reasons are global travel patterns. Business travel, for example, and tourism. There's a lot of it between and to Europe and North America. And of course, there are a lot of international travel hubs in both of these places. Lower income countries in sub-Saharan Africa have some minimum epidemic preparedness as a result of Ebola and yellow fever. For example, there's routine temperature screening at borders. Lower income countries are also less globalized and less urbanized. Only 43% of Africa is urbanized, and it's the lowest rate in the world. It's easier to maintain physical distance in a rural area, of course, and because of resource constraints, there's much less traveling nationally and internationally among citizens of these places. In part, as a result of these factors, Africa is not a significant source of greenhouse gas emissions, yet is projected to be extremely badly hit by climate change and its consequences. Likewise, although Africa has the fewest COVID-19 cases, the pandemic is already having catastrophic social and economic consequences in the region. Like everywhere, those making the least have the most to lose, and Africa is projected to lose 40 million jobs. Only about 10% of the economically active population of sub-Saharan Africa is covered by statutory social security schemes. Economists are saying that COVID-19 threatens to undo all the economic gains made in sub-Saharan Africa over the past decade. However, there is actually a positive global trend we are seeing as a result of this pandemic, which goes back to the environmental issues that gave rise to it. The environment is bouncing back in places that have shut down. Cities all over the world are seeing record lows in air pollution. The sound of birdsong is returning to cities. Wildlife are wandering the streets and returning to coasts. Other bodies of water are reportedly cleaner than they've been for decades. And in the meantime, the price of oil has collapsed down to $20 a barrel because of decreased demand. This is bad news for oil-producing nations like Nigeria and Angola and Canada. But in the context of our future on this planet as humans, it's good news. It's not a coincidence that as our global economy is shutting or has shut down, the environment is improving. Our economy currently largely depends on exploitation of the environment to grow. It's also an economy that by design creates and reinforces health and social inequities. It's ironic to me that the economy is collapsing because of the pandemic that it essentially helped to create. COVID-19 is just the tip of the iceberg in terms of the impact that climate and environmental changes are having on human population health. COVID-19 has the potential to be a major catalytic event, one where we collectively recognize our profound interconnectedness as humans and our dependency on nature. COVID-19 could be the thin edge of the wedge of the radical changes needed both for an environmentally sustainable economy and to level the playing field socioeconomically at the same time. And just for example, adequate social protections would prevent the poorest people from having to resort to destroying the environment to feed their families, for example, through poaching or deforestation. Right now, we have the opportunity to demand and drive the radical changes needed to live. But the real question is, will we take it? And I just wanted to leave you with this. The world says there's no way we can shut everything down in order to lower emissions, slow climate change, and protect the environment. And Mother Nature says, here's a virus, practice. Thank you very much.
Thank you, Paula. That was a fabulous sort of distillation of some of the elements that we haven't yet touched on in our webinar series. Lisa, I'd like to turn to you because you can bring a very insightful perspective on human rights in the context of COVID-19, something we've thus far not heard a great deal about.
Thank you, Ross. Well, I want to first thank Erica for setting up this panel and inviting me to participate. We are seeing so little discussion about human rights in the public domain around COVID, and human rights are really fundamental to effective public health responses that are transparent, accountable, proportionate, and fair. And I think what we're seeing with COVID is how it's bringing to life some of the foundational ideas in human rights law and theory, which is that all human rights are indivisible and equally important and really foundational to good public health. Now, these are ideas that hold true in the ordinary course of events, but it's all the more important in a time of crisis. And COVID is an extraordinarily disruptive health crisis. It's a once-in-a-century health event. And I think it's very likely to fundamentally change how we think about global health, about human rights, and about the fairness of the systems we live in, primarily because of how effectively it's highlighting how those systems and where those systems are weak, unfair, and harmful. And we're seeing that already in how COVID is operating to surface some of the unspoken rules of the world we live in about who matters, who gets access to scarce resources, who can afford to stay home, who can actually practice social distancing. And we're already seeing infections in some parts of the US map onto income gradients. And we're seeing the severity of illness and death from COVID amplified not just by age and health, but by factors like race. So COVID, I agree with Paula that COVID is something that really could catalyze tremendous change. And we see this function in human rights law where some of the biggest transformations in human rights have come after crises. The modern project of international human rights law emerged after the atrocities of World War II. So COVID could really, from human rights perspective, redefine and change our understandings of what it means to say that everybody has the right to health and that governments hold duties to protect everybody's health. And I think it's surely going to transform how we understand global health too. Global health is clearly not this thing that just happens out there across the world. It's happening right now in our backyards, in our living rooms, and it probably always was. So maybe the first point to make is just that the imperative for governments to act urgently is rooted in human rights, like rights to life, rights to health. And the right to health in particular offers really important guidance for public health responses. It requires governments to ensure access to good quality and affordable healthcare and to the conditions that underlie health, like water, sanitation, food. And this includes a very explicit duty to prevent, treat, and control disease, including through ensuring systems of urgent medical care in epidemics. Now, with COVID, this means very practical things like ensuring equitable access to affordable testing and care, ensuring that health workers have appropriate protective gear, and ensuring that our health systems are strong enough to respond to system shocks like this. And from a global health and human rights perspective, it's really disturbing to see how governments are failing on this, including wealthy governments. We've seen pandemic preparedness treated as a disposable part of policy and budgets, and a general lack of preparedness for a pandemic made worse by underfunding of health systems under long-standing global economic policies that generally deprioritize social spending and then double down on spending cuts after financial crises like we saw in 2008. And I think this is at least part of the reason why we're seeing ostensibly universal systems in places like Italy, Spain, and the UK struggling to respond to COVID. And I'd say that we're probably seeing the effects of austerity and underfunding play out here in Canada and in Ontario. In Ontario, access to testing is strictly limited to those who can widely spread the illness, which is, I think, a very common sense rationing when you don't have enough equipment, labs, and people to test everyone. But I think it's questionable how different the situation would have been in without long-standing underfunding of health and without the kind of healthcare cuts we've seen over the last few years to hospitals, public health units, services, staffing. We might never have been able to avert rationing and testing of care at all, but we'd certainly be rationing from a higher baseline with far more people able to be tested, more beds, more workers, more units, and a stronger health system more able to cope with an emergency like this. From a global health perspective, it's particularly concerning what COVID will mean for something like universal health coverage under the Sustainable Development Goals, which in many important respects had already been going in the wrong direction before COVID, with insufficient domestic and international health financing, and catastrophic health expenditures growing since 2000. And I think if you have under-resourced systems being overwhelmed by COVID and COVID testing and treatment costs being pushed onto people, it's a really terrible cocktail for health system failures and for higher mortalities from a range of causes, and for people to be pushed more further into poverty and insecurity. And I think it really amplifies the need for more global assistance and cooperation when it comes to key COVID needs. And I think I'll stop there.
Thanks, Lisa. So now we've had a kind of global environmental, a global human rights perspective. Arjumand, I want to turn to you with your interest in equity and health equity. What kind of global perspectives have you gleaned that might be actually informative to us here?
Thanks so much, Ross, and thank you, Erica, and all for organizing this panel. I really appreciate the chance to be with you. I think for me, the question of equity comes really into focus in terms of some of the things that Lisa was talking about. We see so many inequities, not just between countries, but also within countries. And as a couple of the panelists have sort of remarked, you see this happening even in high income settings. So I'm going to situate my comments in that context of what we see happening within countries, and specifically within high income countries where you would expect governments to be able to do a lot better. So let me take a step back and say a little bit about why equity plays into a basic understanding of disease spread and treatment of disease. So everything we've learned in public health about infectious disease and pandemics, from tuberculosis to influenza to HIV, is that people are not equally likely to be exposed, nor are all communities likely to experience the same degree of disease severity or mortality. And in fact, one of the all-time most important public health findings is that no matter the disease, whether it's infectious or chronic, like a cardiovascular disease, and no matter how you get the disease, whether it's through living conditions or your eating habits or how much stress you have or so on, virtually all of human health can be traced back to our socioeconomic position in society. Our income, our wealth levels, our job, and more broadly, our place in the labor market, the racial group to which we belong, and so on. So it's really remarkable that in some ways it just all comes back to social and economic factors as sort of being fundamental or root causes. So if we take the case of coronavirus, which is spread through something we virtually all do, which is be near one another in one form or another, it conjures the sense that we should probably be more or less equally likely to be exposed to the virus. And we've heard from politicians and public health officials that this virus doesn't discriminate and it's the great equalizer, but it isn't. And it's not that so much that the virus isn't, but certainly our society is set up so that it won't be the case that we will be equally exposed to the virus. In the US, another high-income country, as Lisa mentioned, we're seeing emerging evidence of higher rates of infection in lower income groups, in Black people compared to white people. Why might this be for the purpose of coronavirus? What's the mechanism? Well, as a simple example, as Lisa mentioned, there are differences in who's able to social distance. So people who have the kinds of jobs that can be done at home tend to be higher income earners, tend to be white, whereas those who are essential workers tend to be lower wage, tend to be Black and brown, and that's true in Canada as well. So, those jobs, those essential service jobs, mean that you aren't able to stay home, that you're in closer physical proximity to others, and so on. So that is on top of the well-documented discrimination we see in the healthcare system, where there are many reports, as Lisa mentioned, there are sort of basic infrastructure inequalities in who gets tested and who doesn't. And there's also sort of insidious ways this works. For example, in the case of Black maternal mortality in the US, we know that there's a lot of reports of dismissal of people's symptoms. And you can imagine that in coronavirus, where the symptoms are so sort of ubiquitous for other conditions as well, that you may have differences in how seriously people's symptoms are being taken. So, currently, even though that's all the case, we currently don't have a system in Canada where we can get information, data on socioeconomics, on race, and figure out what the exact situation is in Canada. How is coronavirus spreading by the very factors we know to be the fundamental determinants of health? So, it's really remarkable that we hear sort of an all lives matter argument from the Ontario Chief Medical Officer, who's basically said we don't need to collect race data because we care about all Canadians. But if that were the case, why would we be concerned about vulnerability at all, as we rightfully are? Why would we be concerned about, for example, the elderly? So my sense is that we aren't taking an all lives matter approach to the pandemic, and we shouldn't be. But that we are reticent to talk about some forms of vulnerability more than we are others. So I think that stance, that idea that we aren't willing to understand the basic epidemiology, knowing what we know in public health, knowing the science of public health tells us that at the end of the day, if you want to understand disease spread, you're going to have to go back to social and economic factors to understand the groups that are most vulnerable. It seems rather indefensible not to have that data and to in fact state that we don't need that data. So for example, because we don't have that data, we aren't modeling how COVID-19 cases can be managed by hospitals in places that have different proportions of higher or lower socioeconomic groups, and therefore a higher or lower burden of cases that they're likely to see. We aren't understanding where there might be concentrations of viral load in neighborhoods where you have higher proportions of people who are lower income, who are more likely to be essential service workers, and therefore clustered together, and so on. And in other words, we're basically ignoring what is one of the most important public health insights of our time. At the same time, our leaders have been doing things that are fairly unprecedented. I think, as Paula pointed out, we're doing a sort of suspension of social liberties on a scale and in a way that people said we can't do, we couldn't possibly do, but we're doing. We've had policies come about like safe supply of opioids in Vancouver, housing of homeless individuals with suspected COVID in Montreal, a partial, at least temporary basic income program, which are policies that for a long time were considered to be infeasible, totally dismissed, but here we are implementing some of them in a catastrophic situation. So that tells me we can do something, and we can do it quickly, and we can do it forcefully. And so my take is that if the government really wants to get a handle on the situation and do something about COVID in general, they have to pay attention to the equity components, the social and economic factors, sooner rather than later.
Thanks, Arjun. Points well taken in indicating that we can do the possible when there's the political will. Let's see how much of that carries forward. So now we've had environmental global concerns, human rights, equity issues. Now it's time to turn to the student on our panel, Sarah, who's going to give us kind of an anthropological perspective. Sarah, I hope your studies have not been too badly disturbed by this outbreak, and I hand the floor over to you.
Ross. So before I begin, I'm going to talk about language and power today, but I think it's quite revealing that it took a global pandemic of this magnitude to get people in power to acknowledge publicly something that marginalized folks have been saying all along, that the way in which our political and economic systems operate are fundamentally unequal and inequitable. And as we reflect on COVID-19, how it differently impacts populations, we also need to keep in mind these brilliant conversations that are being had at this moment, so that these inequalities that predispose some people more than others to infection or further marginalization do not become understood as unfortunate yet ultimately unavoidable casualties of the COVID-19 response. And so one way to prevent this is to be cognizant of the type of language that folks are using, and to avoid a language that, victim blames. This means being cognizant of power that language possesses, and that language creates and not simply reflects meaning. This means that how we talk about the COVID-19 problem today influences how people come to understand it, which then determines what the appropriate course of action is to solve the problem. For example, take HIV. In its early years, certain marginalized populations were defined and categorized by the biomedical community as risk groups because these groups had higher HIV prevalence rates. However, by labeling some populations more at risk than others, the blame for infection becomes something within or fundamental to these populations, rather than pointing to the underlying inequities that make some people more susceptible to HIV infection than others. So in the late 1980s, when studies showed that rates of HIV infection in African populations were much higher than those found in North America, researchers were quick to blame culture and cultural practices on high rates of infection, rather than, say, the long history of colonial extraction and capitalist exploitation that made labor migration, for example, a necessity for survival. So with this example, we can see the way in which problems are communicated is fundamental to imagining appropriate solutions that will not exacerbate but address underlying social, economic, and political inequalities. So let me move to COVID-19. So yes, we are seeing how COVID-19 exposes or illuminates existing inequities, and yes, we need to find a solution to this pandemic. But solutions depend on what we've determined the cause of the problem to be and how we talk about the problem. So if our goal is to make this world a more equitable place, we need to ensure that our approach does not reproduce or create new stigmas and assumptions about the other. We need to be cognizant of how we frame the pandemic, how we frame risk, and where we place blame. And how we talk about solutions. For example, right now there's a lot of talk about individual behavior change policies like social or physical distancing. See that change in language that are based on the assumption that everyone can follow these rules accordingly. And we're seeing conversations about social, physical distancing. We're seeing, though, at the same time, higher rates of xenophobia, and we're seeing a lot of discourses of blame happening. So take some recent stats in the US. In Louisiana, African Americans account for 70% of deaths from COVID-19, but make up only 33% of the population. Detroit, which is almost 80% Black, has the most concentrated cases in Michigan. So we've seen two types of responses emerging from these stats. One is victim blaming, much like in the case of HIV that I mentioned earlier. We are seeing accounts of Black folks being blamed for having higher rates of infection. The other side, however, and is how I think we should be approaching these disturbing statistics, is one that considers the structural violences or the social determinants of health, like structural racism, when we talk about problems and talk about COVID-19. And this isn't just happening in North America or high-income countries. This same dynamic is being reproduced around the world. Another example, completely different context, but is in Uganda, for example. The president, in one of his first national addresses a few weeks back, because he's been addressing the nation regularly over the course of the last month, he blamed people's carelessness to stay home and blamed people refusing to stay in quarantine for ultimately the severe lockdown measures that he and his government had to enforce. He said, and this is a quote, "There is less risk now with maximum restrictions," which means like total lockdown, that as in people cannot move in the country, than gambling with the virus. So this type of blaming the victim rhetoric the world over is dangerous because it becomes naturalized. And this is what creates the stigma and what creates discrimination. And it ultimately places blame on individual people for spreading COVID-19. And I think it would be immodest to claim that COVID-19 reached the magnitude that it did because people did not appropriately practice social distancing or, were careless and left their houses, or because some populations are just naturally predisposed to infection more than others. So, thank you.
Thank you, Sarah. So now we've had 4 very diverse perspectives, and there's one last perspective that we'd like to get, and perhaps in many ways one of the most central to our concerns, focusing on workers' health. We know that there's been a tremendous economic impact of this pandemic, and many people have lost their work, and many people were precariously employed before that. So Erica, I'd like to turn to you for a perspective on workers' health in the context of COVID-19.
Thank you, Ross, and thanks to my panelists on this webinar today. It's really a pleasure to be here and to talk a little bit about some very fundamental themes that I don't think one webinar could fully address. I'm going to particularly focus my remarks on workers' health, as Ross mentioned, in the context of COVID-19, but interrogate, I think, some important questions about why some workers are more at risk than others. So there are many discourses at play as to why that might be the case. One is maybe they feel they have no choice, in inverted commas, but to work because they are already experiencing high levels of material and social deprivation. They have a higher chance of getting infected because of persistent inequities that Arjun and others have nicely illustrated already. They're also more likely to be negatively affected in the post-pandemic period because they run a greater risk of losing work and actually getting that work back. One of the main points that I want to make, though, in my opening remarks is, are we actually capturing the right data about all workers, including informal workers, to better design policies that need to come out of this response, not just the ones that are temporarily being put in place, but the ones that need to be sustained in the long term. But let me just situate my comments in the global arena in terms of who are we talking about when it comes to workers. So in 2019, the global working age population, so that's people 15 years and older, was about 5.7 billion people, according to the UN. And about 39% of that were not part of the labor force already at that point in time. And 57% were in employment, and the remaining individuals were unemployed. But what has remained a challenge, and I think is further exacerbated and also illuminated by a pandemic like COVID-19, is how many really had what is called decent work. And so for those of you who aren't familiar with this concept, it's a concept that has been coined by the International Labor Organization, or ILO, which isn't just about creating jobs, but it's also about guaranteeing rights at work, extending social protection, a concept that Paula touched on, and promoting social dialogue. But as you can well imagine, it's highly subject to interpretation, and there's a fair bit of cherry picking that's already going on in terms of how we ensure decent work conditions and provide the kinds of safeguards for people who are losing their jobs and actually still need to go out and do work, but are essential workers and are highly vulnerable during this pandemic. And despite calls for ensuring a decent floor of working conditions and equal opportunity for work, I would argue that globally, and this predates the pandemic, we've tended to continue to observe what I would call a race to the bottom rather than efforts to really level up and have equity at the center. This reminds me that, and I think Sarah has touched on this nicely, how language really frames. What do we mean by decent work? Over 10 years ago, colleagues and I did an analysis of the ILO framing of decent work, and we found post-economic crises in 2008 and 9 that the use of jobs over decent work was reinforcing broader discourses regarding who's in charge of the work agenda. markets, individual workers who are personally responsible and accountable. And while we've seen some measures to the contrary, I would argue that we need to really hold our politicians and political leaders to the fire to ensure that we don't return back to that way of thinking about who's really responsible for decent work. So this new post-pandemic new normal that we go back to hopefully will not reflect the individual optimal and efficient choices that the quote market can actually ensure. We need to imagine alternatives. The other point that I wanted to raise has to do with what we measure and don't measure, and I think Arjuman's comments has touched on this point very nicely. What I'd like to focus on is what we're primarily valuing in terms of measurement when it comes to the quantity and the quality of work. There are efforts to measure whether work is dignified, whether work provides a decent income, and policy measures that are aimed at protecting workers' rights. But I think it goes without saying that more traditional indicators such as unemployment rates, the poverty rate are still dominating. And part of the problem with these indicators, which are frequently reported and definitely getting a lot of headlines during COVID-19, is that they only tell partially the story. So there are many people who are missing from those indicators. So in the case of unemployment, it doesn't account for people in work who would like to work more paid hours, or in other words, underemployed. And of course, a situation that's becoming further exacerbated in the current COVID-19 situation, as well as employment for people who, for whatever personal reasons or other factors, structural in nature, including this pandemic, cannot actually actively search for work. But the other fundamental issue is that the percentage rate is based on formal work where there's an established relationship between employers and employees. Yet recent estimates have shown, and this is pre-COVID-19, that 70% of informal work is performed in low and middle income countries. Some estimates, including in India, bill that at 90%. And high income countries are not excluded. This was once thought to be a quote, developing country problem. However, we are seeing new ways of informalization that have been emerging, again, before this pandemic struck globally. And these informal workers are remaining invisible in official statistics. So there's a serious data gap, I would argue, about who workers are and why this matters. And why this is important is that many informal workers do share characteristics with precarious work. Working conditions that are low wage, that are temporary, contract-based, do not have the social protections in place. Their very occupation, if they do have work, puts their health and well-being at risk in significant ways. And COVID-19 is only the latest risk. So what can act as a buffer? I'll just pick up briefly before I close on a comment that Paula made, which is that social protection, of course, is a key pillar to ensuring decent work, and very much linked to that. So social protection includes access to universal health coverage, childcare, those would be some examples. Before COVID-19, only 45.2% of the global population had access to one social protection cash benefit. So that means over 4 billion people had been left unprotected, and this was before the COVID-19 pandemic struck. So the bottom line is that these and other workers who do not have social protection, who do not have decent work conditions, this is not a new phenomenon. A pandemic like this really exacerbates the inequities already faced by these workers. And I think we have to learn and act during and from this pandemic and make fundamental changes to our social and economic systems. We need to get better and more sustainable social protection measures in place for people, and align those to other efforts such as universal health coverage.
Thanks, Erica. So we had some curated questions. One of the things that we wanted to touch on in this webinar was the impact of COVID-19 on the attainment of the Sustainable Development Goals. So I'm going to actually pose a couple of questions to the panelists, and we're starting to get a lot of questions from the audience, and I think probably the panelists would love to respond to the questions from the audience. I'm seeing lots of smiles and head nodding there. But just so that we don't miss out on a discussion on the Sustainable Development Goals. I'm going to ask Paula, so in light of Sustainable Development Goal 19, how do we think about reorienting or redesigning an economy around health, equity, and environmental sustainability? Do you have any thoughts on how we might proceed in that direction?
Yeah, so, you know, I think that to some extent we've been brainwashed into thinking that our global neoliberal economy, the one we have today, is the way that it's always been and the way that it has to be. And, you know, we really have to try to imagine another way of living. And it's an opportunity actually that COVID-19 gives us, is to see another way that we could live. We have to, for example, get away from an extractive economy that worships profits above all else, investing in renewable sources of energy, stopping subsidies to the oil and gas industry, for example. We also have to seriously change our patterns of consumption. You know, consumption is driving very much climate environmental changes on a planetary scale. And if we don't find a way of changing those, we aren't really going to get very far, very fast. I think Erica did a really good job of talking about the need for social protections, and they need to be invested in. Guaranteed minimum income, universal health care, free quality education, and labor protections. You know, we need to invest in local and sustainable food production and sustainable water use. If we depend forever on outside sources for our food, you can imagine what would happen now, given this epidemic, if supply chains were more interrupted than they already are. You know, in short, we need to redesign an economy. One that's been proposed is called a circular economy. And that's an economy that decouples economic growth and development from the consumption of finite resources. You can think of it as an economy without waste. You know, I think if we were able to start moving in these directions, we would actually be able to accomplish a lot of the SDGs, at least, you know, one step at a time, but we would probably get further ahead faster than we are today.
Thanks, Paula. Erica, I'm going to turn to you. One of the sustainable development goals is on decent work and economic growth, and of course the important third one on good health and well-being. How do you see this crisis impacting the potential to realize these sustainable development goals?
Yeah, thanks for that question. Interestingly, I think I'm going to read out the actual wording of SDG 8 actually to make the point. SDG 8 aims to promote inclusive and sustainable economic growth, as Paula just alluded to, and employment and decent work for all. There are inherent tensions in that very goal. And so I think it actually nicely illustrates the point in time we're at where the pandemic could actually help us to redefine what we value as societies. And I think the societies that are less unequal are the ones that may be the ones who end up better responding to this pandemic. The other example I wanted to use actually takes the SDG 8 with SDG 3, which is the one on universal health coverage, to talk about a vulnerable type of health worker and use the community health workers as the example. So there are many types of community health workers around the globe. In India, for example, the ASHA program has been around for 15 years. What's interesting, I find, about the COVID-19 response is that the over 9 million ASHAs, who are women predominantly, very vulnerable workers, are the ones that are being relied upon, who are kind of the front line of healthcare because they are providing point of care access to education about COVID-19. But they are also the ones with the least rights, the least well-defined wages. And so they are helping to deliver COVID-19 messaging in that context. And we have many examples of other places. So there's this interesting conundrum here that on the one hand, these workers were seeking better rights, better wages from their governments, but are also now the ones being heavily relied upon in this current context. And I think we have many other examples of essential workers in this country alone, we have the people who are the most poorly paid are the ones also that we're relying upon quite heavily when it comes to groceries and other essential services.
Thanks, Erica. Arjumand, I'm going to ask you to just briefly reflect on the SDG 10 about reducing inequalities. You ended your discussion on a very positive note about the possible worlds that we can create. What are your thoughts about how we might be able to use this as an opportunity to actually meaningfully take action to reduce inequality?
Thanks very much, Ross. So I have sort of two ideas about what this current situation has done in terms of making us think about the world of possibilities. So one is a little more optimistic, which is that it could be that the path dependency it's taken us down of needing to put in social supports that, as Lisa had mentioned, we had scaled back from austerity measures, and as Paula said, sort of from a decades-long neoliberal project. The idea that we're now starting to recognize that we have to prop up the economy by propping up many of the most economically vulnerable members of society may take us down a trajectory where we have to keep going, where these are not just emergency measures. I have a less optimistic read as well, though, and that is that often these kinds of initiatives do fall off. They aren't sustained. And even to the extent that they are, I think what coronavirus has highlighted for us is not just that there are inequalities, but that there is a structuring of society to structure risk in a way that is so deeply entrenched that we don't all have equal opportunity to the inequality either. So if you take coronavirus and you think about essential work, there's an argument to be made that the very reason we're sitting here on this webinar is because there are essential workers outside doing things that allow us to be home and be fed and be comfortable in our homes. And that work would have to get done if we wanted to be able to exist at the standard of living that we have through a pandemic like this. And the question is, who does that work? And even if we protect people, someone's out there doing that work while someone's at home. And so I think there is a real need to look at definitely social protections and so on, but also the fundamental distribution of social class and of social opportunity, of economic opportunity, and of protection for your own health status. So that imagine a world where we were all equally as likely to be out there being essential workers. That's a whole other world than the one we have.
Thanks, Arjumand. So I'm going to come to Sarah next and then to Lisa, because the question for Lisa leads into actually very nicely the first question we have from the audience. Sarah, I know you wanted to say something about humanitarianism and the humanitarian dimensions of the COVID response. If you'd like to take a few minutes to say that, and then I'll turn to Lisa.
Yeah, thanks, Ross. So I think what I'm going to say kind of leads, it's quite nice. And so I think what COVID-19 reveals is actually the limits of humanitarianism as both a form of intervention, but also as a structure of feeling. So we think of humanitarianism as, you know, often as a compassion project. I'm not talking about it as just an intervention. You know, we're talking about charities, we're talking about compassion for the other, but, you know, we need to recognize that compassion is always met with exclusion, right? During Ebola, for example, support for humanitarian intervention was about compassion, you know, and saving lives, of course, but it was also about containing a threat, right? Keeping the threat over there, so, and ensuring that it wouldn't come here, right? So, And I know that this might be a low-hanging fruit, but the US just deported 400 migrant children under new rules seeking to limit the spread of the virus, right? And so we're seeing forms of humanitarian compassion play out in very different ways. It can go the other way. For example, the First Ontario Centre in Hamilton is opening a homeless shelter. Or in London, England, shelter and secure folks were relocated to hotels. But yes, these measures protect marginalized folks, but ultimately it's because they pose a threat to public health. And so, you know, this is what I'm saying, that humanitarianism is fundamentally based on a relationship of inequality. And I think right now it would be an ideal time to reflect on what drives us to act, what drives us to make the solutions that we make. Is it for security? Is it for self-protection? Or is it for justice? And is it to eliminate inequality? Thank you.
Thanks, Sarah. So as usual, we have a large number of very insightful questions coming from the audience. And I'm going to frame one for Lisa that sort of touches on issues around priority setting and interests. And I think rights definitely play a role into this. So one of the big questions is, how are we going to walk out of this situation? What's the possible exit strategy? And it's kind of a reverse priority setting question. How is it that we're going to balance the interests of the economy with the interests of individuals who may have been differentially impacted? So as we look up the following months in the future, there's going to be a lot of pressure to open up the economy and to sort of like kickstart things fast, but that might actually leave people who have been further disadvantaged by COVID-19 in the being more disadvantaged. So Lisa, any thoughts from a human rights perspective about how we might engage in this interest balancing exercise?
Well, I mean, Ross, I think the first thing to say is this is not a question for human rights people to answer. This is really going to be fundamentally, this is the question of, this is what epidemiologists are expert in being able to respond to. And I think we should all be looking to what they say. Now, the extent to which expertise and public health knowledge will actually play a role in what governments do is obviously going to be the most fundamental question. I mean, we've seen in prior pandemics that economic questions are often prioritized over the health of vulnerable people. I mean, we saw this so clearly around HIV, access to antiretrovirals. So it's going to be, I think, a really a question of the extent to which we're able to hold governments accountable. And it really makes me think here about Amartya Sen's famous insight about, you know, you don't have famines happening in democracies because elected governments can't afford to kill large portions of their electorate. Now, this is a piece of Sen's insights which has been critiqued because we see, there's a lot of hunger and poverty that happens in democracies. But I think we're really going to see the truth of that in how we come out of COVID. And we're already seeing here we're in the middle of the crisis. We are literally surrounded by the most extraordinary health crisis we've ever seen. And we're already seeing people saying, the politicians saying, well, look who's at, the only people who really we have to lose here are the old and the sick. Maybe we should be thinking about opening our economies. And so I'm very concerned about what this is going to look like. And I think we're really going to see very different responses from different governments. And it really is going to be a test of what their priorities are.
Thanks, Lisa. Do any other panelists want to weigh in on that question?
I think I'll just add that I think Lisa is understating a little bit how important human rights scholarship is for this kind of work. I mean, I think having principles based on which we decide what scenarios are tolerable is a really important piece of this. So for example, in this situation, you could do multiple strategies. You could just start the economy, and you could just, let what happens happen with disregard to equity, or you could do something different. And so I think people who can give various scenarios on what the data suggest can provide numbers around those various options, but we need people like Lisa to really help us understand what the implications and consequences of those various scenarios are.
Thanks. So as a follow-up question to that, is that people in low socioeconomic situations and precarious work are already suffering the consequences of the pandemic with an economic depression on the horizon. How do we ensure that workers' rights and human rights are enhanced despite severe economic conditions globally? So that kind of builds on the question that we've just been exploring. Lisa, would you like to chime in there?
Sure. I mean, so thank you, Arjun, for really highlighting the critical importance of having a fair, legitimate principles guide what it is that we do. And certainly, from a human rights perspective, there are very strong principles and standards and binding legal duties that governments should be following in terms of what it is that they do in the context of this crisis, what it is that they do afterwards, and what kinds of measures that restrict rights now are legitimate and proportional. And certainly one of the really concerning things is the way that governments are using COVID as a pretext to kind of power grab and abuse vulnerable groups. I mean, we've seen this in a bunch of countries. Hungary introduced an emergency law without a time limit that allows the prime minister to rule by decree, and we're seeing social distancing measures being used as a pretext to crack down on already vulnerable groups, like we saw with the detention of a group of people at an LGBT shelter in Uganda. So we really need to be looking to the principles in terms of the kinds of policies that we have, in terms of what is a fair package of support outside the health system, paid leave, sort of tax relief, etc. And that really is something that it's going to be critical to hold governments to account for doing.
Does anybody else want to chime in on that? Erica?
Yeah, I'd like to pick up on a point Arjun made about the distribution or the redistribution of wealth. This is not a new idea. And I think if we go back to the old playbook about who actually isn't taxed, and if we don't deal with things that, like dealing with the 1% who are evading tax, then we're not actually, I think, dealing some of the fundamental ways in which our economy has been structured and who is getting a hall pass and who isn't. So some of these ways in which we redistribute wealth also, I think, require some innovative measures. Interestingly, there's been talk again about a guaranteed income, and we're not here to debate because there are very different definitions of what that might look like. But could we actually use this period where some creative and innovative policy measures are being put in place to actually evaluate them and to see what kind of unintended consequences they might have had, good or otherwise, and not sort of go back to business as usual. At times, a pandemic can disrupt systems in a way to create some new opportunities, but we may not capitalize on those and evaluate them. So I think putting on our privileged role as researchers, what opportunities do we also have about what gets actually evaluated in this point in time? I think it's an important question.
Thanks, Erica. We have time for one last question, and it's one that's been, I'm going to use moderator's prerogative to choose this question, because it's one that I've been puzzling about. So someone asks that they're curious if Canada has a role to play or a responsibility to contribute to addressing equity issues in other countries that are being badly affected by COVID-19 response. And what is a global responsibility in these times, aside from contributing to containment? Does anybody want to give an answer to that? Everybody seems to have pulled back to very local concerns. So are you going to give us a global cosmopolitan view here, Lisa?
I'll give you an international human rights law perspective, which is that there are certainly the idea that states hold duties of assistance and cooperation when it comes to human rights, and certainly all the more important when it comes to what we consider to be core human rights interests, which are the really fundamental, essential parts of human rights, which in the context of health is access to essential medicines, access to essential health services, access for healthcare workers to protective gear. And what I think what's extremely concerned, certainly Canada has a really important role to play. I mean, what's been really, really disturbing is to watch the kind of sort of Lord of the Flies scenarios playing out around something like protective gear, where you have governments seizing shipments and trying to prohibit exports to other countries. You know, this is just the very last way we want to be distributing resources. And I think Canada really has always had an important role to play in terms of setting an example and doing relatively good things out in the world. And I think it has a very important role to play here.
So I'm going to go around to each of the panelists for a quick last word, and they can pick up on that reflection before I close it. I'll start with you, Paula, since you're the furthest away.
I don't really have anything to add. I think Lisa did a great job of summarizing the kind of big picture human rights perspective around it. I think countries have a lot that they can do to influence equity issues in countries that they're supporting. And I think that they should try to use their voices and whatever clout they have to encourage countries to, you know, to have an equitable response across the board.
Thanks. Sarah, any last words?
I don't really have anything to add, just to say thank you. And, you know, Paula, I think you mentioned this before, but you talked about how, and I also love this imaginings of alternative futures discourse that's happening right now. And I hope that we can all reflect and sit on this, and what kind of future do we want, and what would that mean? Yeah, so that's it. Thank you.
Arjumand?
I'll just add my thanks, and maybe just note that when we think about what we might say to other countries, we should probably think about who those other countries are. Are they countries that hold power, hold resources, hold sway? And what might we say to countries like that versus countries that are really bearing the brunt of those decisions?
And Erica, as our host, you get the last word.
Yeah, well, I just want to
close.
pick up on Arjumand's last point. I think we have to be very careful that we don't use this pandemic as an opportunity to preach and to reinforce colonialism and some of the practices that have defined relationships between different countries. There are, I think, some powerful ideas coming out of many different countries that we could be learning from. Nobody has the one answer, and we can't make assumptions. Just taking it back to the focus that I brought today about how labor markets are structured. So who are we to say that we have the answers about how to deal with work in different countries? That being said, there is a huge interdependency when it comes to workers between countries. We depend on migrant workers, for example, who come here and do the jobs that many Canadians haven't done. And so we have to be really careful about how, what kind of decisions we make as a country and what kind of advice we give.
Thanks, Erica. So I'll just be mindful that it's time to close, but to point out that besides supporting other countries, we may want to increase our support for the World Health Organization in light of certain pronouncements made in the last 24 hours about withdrawing heavy financial support from the World Health Organization. It is the one true international organization that has a critical role to play in the response to COVID-19. So I'd like to thank our panelists, Erica, Lisa, Paula, Arjumand, Sarah, incredibly insightful comments. I want to thank the audience for their questions and for attending. As just was pointed out by that this is being recorded and it will be archived and available to be watched. We will take the questions that were not answered and find a way of providing written answers from the panelists. So I wish everybody good health. I hope you and your families are safe and well. Keep sane, keep well, wash your hands, solidarity 6 feet apart, and we'll see you next week at our next webinar. Thanks very much.
Thank you.